Hello everyone and welcome to healthmedics.com. Here I'll be teaching you guys what bacterial infection is all about and how to get rid of bacterial infections out of your system, out of your body totally. I'll take you tutorial on how to prepare medications by yourself, how to be your own doctor, and how to be a doctor to other people around you. If you just follow this tutorial course, you get to understand what bacteria is all about, bacterial infection of different types and their cure, and how you can use herbs to treat yourself of any bacterial infection. Now I think it will be apposite for us to know what bacteria is all about, those that are harmless and those that are pathogenic. Now bacteria are microscopic single-celled organisms. There are thousands of different kinds and they live in the body of people and animals, especially on the skin and in the airways, mouth, and digestive, reproductive, and urinary tracts. Some are harmless while some are harmful. They can be found as well in every imaginable environment all over the world. They live in soil, seawater, and deep within the earth crust. Now let's talk about bacterial organization, or how they are being grouped, their category. Some are categorized as staining. Bacteria may be classified by color they turn after certain chemicals stains are applied to them. A commonly used stain is the gram stain. Some bacteria stain blue, they are called gram positive. Others stain red, they are called gram negative. Gram positive and gram negative bacteria stain differently because their cell wall are different. They also cause different types of infections and different types of antibiotics are effective against them. The gram-negative bacteria are more infectious compared to gram-positive ones and are more resistant to antibiotic medications. Let's talk about the shapes. All bacteria may be classified as one of three basic shapes. Those that are sphere, known as cocci, like the pneumococci, the Staphylococcus, Streptococci, and also the rod ones like the bacilli and the spiral or helix, which are the spirochetes. Now there are also those that are classified based on their oxygen requirement. Bacteria are also classified by whether they need oxygen to live and grow. Those that need oxygen are called aerobes. Those that have trouble living or growing when oxygen is present are called anaerobes. That is, in the absence of oxygen, they grow. Some bacteria are called facultative bacteria. They can live and grow with or without oxygen. In addition to this, there are bacteria that produce more toxin and replicate more under cold environment than warm environment, e.g. cyanobacteria. Now the question is, what part of the body can bacteria be found? Most of these bacteria reside on the skin and teeth, in the space between teeth and gums, and in the mucous membrane that line in the throat, intestine, and vagina. The species differ at each site, reflecting the different environment at each site. Antibiotic resistance bacteria. Some bacteria are naturally resistant to certain antibiotics. These bacteria are enclosed in a protective capsule. This helps prevent white blood cells, which fight infection, from ingesting the bacteria. Such bacteria are described as encapsulated. Under the capsule, gram-negative bacteria have an outer membrane that protects them against certain antibiotics when disrupted. This membrane releases toxic substances called endotoxin. Endotoxin contribute to the severity of symptoms during infection with gram-negative bacteria. Other bacteria develop resistance to drugs because they acquire genes from other bacteria that have become resistant, or because the genes mutate. For example, soon after the drug penicillin was introduced in the mid-1940s, a few individual Staphylococcus Aerus bacteria acquired genes that made penicillin ineffective against them. The strain that possesses this special gene had a survival advantage when penicillin was commonly used to treat infection. Strains of Staphylococcus Aerus that lacked this new gene were killed by penicillin, allowing the remaining penicillin-resistant bacteria to reproduce and over time become more common. Chemists then altered the penicillin molecule, making a different but similar drug called methicillin, which could kill the penicillin-resistant bacteria. Soon after methicillin was introduced, strains of Staphylococcus aureus developed genes that made them resistant to methicillin and related drugs. These strains are called methicillin-resistant Staphylococcus aureus, MRSA. Maybe you must have heard about this. Diseases that can be caused by harmful bacteria. Bacteria are common in childhood. Infant bacterial diseases such as strep, sore throat, and ear infection. Others cause major diseases such as tuberculosis, plague, syphilis, and cholera. In adults, bacterial infections ranges from staphylococcus, which may involve an internal organ, as in bacterial pneumonia, infection on the lung, or bacterial meningitis, infection of the membrane covering the brain and spinal cord. Pneumococcus, which is also called Streptococcus pneumoniae. Gonorrhea, infertility, candidiasis, low sperm count, urinary tract, and so on. Symptoms of bacterial infection in both men and women: sore throat, skin rash, sometimes reddish, unfair complexioned individual, pimples, pus-filled blisters, or as in folliculitis, red bump or swelling in the eyelid, painful red swelling boils with pus around the private part, vaginal discharge, irregular menstruation, discharge of breast milk, offensive odor of vaginal discharge, frequent fever, itches around the body after birth, rashes around the anus, lip crack and tongue sores, itches around the private part, quick ejaculation, watery sperm, pains or inflammation feelings during urination, loss of memory, neck and joint ache and stiffness, especially after sleep. There are also some that I didn't even mention here, like itches all over the body, rashes all over the body sometimes. Now, treatment of bacterial infection. Just as discussed above, many bacteria are resistant to antibacterial drugs. Some drugs have unbearable side effects that may make you alter your dosage, and then these bacteria will develop more stronger capsules, making them more resistant to antibacterial drugs. Hence, many herbs have been created by God to help man get rid of bacterial infections, such as wonderful cola, garlic onions, white onions, lemongrass, green leaf or salad onion, bitter melon bound juice, etc. Things to avoid during treatment. While you're undergoing this treatment, from the video tutorial that is being provided on our channel on YouTube, we ask you to please stick to the following advice. Avoid cold, frozen and chilled drinks and also food. Avoid bathing cold water during cold weather. Avoid sugary foods and drinks, especially carbohydrates food, as much as you can. I know we cannot do without carbohydrate food, but try as much as you can to avoid them. Avoid beer, alcoholics and other fermented drinks. Avoid frequent ejaculation, especially masturbation aided ejaculation. Avoid sex because of ejaculation. Yogurt and unpasteurized milk. Avoid eating yeast produced products like snacks and bread. When you avoid this, you will notice changes during the treatment. But when you treat yourself and you stick to all these things, eating them, using them, you find out that you are helping the bacteria to develop more, because all this make the environment in your body favorable for their existence. But when you restrict them to these things that we have asked you to avoid during the treatment, you find yourself getting better. Know it that your treatment will not last for a very long time. Therefore, we crave your indulgence to please stick to these advices. Now, things to accept or ingest during treatment: take more honey. It is antibacterial. Eat more of bitter kola. It kills bacteria and some viruses. Eat more of fruit containing carotene, especially apple, carrots, watermelon, etc. They are antioxidants, that is, they stop replication of cells and bacteria such as Staphylococcus and Streptococci. Bathe hot or warm water during cold weather. Drink bitter leaf extract juice or eat it if possible. Eat or drink scent leaf juice extract. Eat more vegetable like pumpkin leaf, etc. to help proper blood cleansing and circulation. Now, the next video is to show you how to prepare these herbs by yourself. Remember, we crave your indulgence to please appreciate the effort by sharing these videos, subscribing to our channel, liking our page on Facebook, commenting, inviting people. Freely you receive, freely you should give out. Also, I want to let you understand that the overview of bacteria provided on this video is just a summary. You can visit our website on www.healthmedics.com to read more about bacteria and their infection. Then you will understand what it means by these bacteria that are very resistant to antibiotics, so that when you treat yourself, you will understand things to avoid more and also understand things to eat, so that these bacteria will go out of your body. Thank you very much, and watch out for the second video, which will be where we'll be showing you all the ingredients or the herbs necessary for treating bacterial infection. Thank you.